Welcome to my channel. My name is Katrina Bird, or my patients call me Dr. Bird, and today we're going to talk about chlamydia. So, if you're interested, stay tuned. So, today we're going to talk about chlamydia trachomatis. So, this is an infection that's very, very common. My goal is to remove stigma regarding these infections. So, let's go deeper. So, first, it's really important to know kind of the prevalence of this infection in our community. So we're thinking about, should we get tested? You know, should I suspect this infection? And so when I'm saying, this is the reason why we need to go over this data. This is data from the CDC. So in 2018, there were 1.8 million cases of chlamydia, and this was nearly 20% increase from 2014. This is a map of the United States. This is also from the CDC. The darker the blue, the more cases are in each state. So places like Louisiana, a lot of the South, New York, Illinois, they have a higher amount of cases of chlamydia as compared to, for example, Maine. So that kind of went over fast, but Maine. So this is probably one of my favorite graphs. It kind of breaks down the number of chlamydia cases by age. When you look at females, there are high rates starting from age 15 to 19, followed by 20 to 24. Men are about the same, with arguably more cases in the 25 to 29 range. That's why when you look at the CDC data or you listen to physicians, they're always like, you have to be careful in individuals age 15 to 24, 25, because these are going to be the age groups where you're going to see the most amount of chlamydia cases. So if you're personally in this age group or your sex partner is in this age group, y'all are at higher risk. Okay. So now let's go over the details of chlamydia. So these little red circles here, this is chlamydia. One thing I want you to know is they're red. That basically represents that they're gram-negative bacteria. So for us as infectious disease doctors, it's important that we know certain characteristics because it helps us figure out what antibiotics we're going to give you to treat. So gram-negative basically means that the bacteria is going to be red when we do a special test called gram stain in the lab. And there are certain antibiotics that will treat gram-negative bacteria. The other thing you need to know is obligate intracellular bacterium. And bacterium is just a singular form of bacteria, which is plural. So basically, this means that this bacteria has to be inside the cell. So that just makes it more difficult to culture, and it also makes it more difficult to kill. These characteristics all help us figure out which antibiotics are going to work best against this infection. Now let's go through the details of what type of infections. So the first one we want to talk about is cervicitis. So what is that? All right, so this is the picture of the female reproductive system. So first you have your vagina, then this first portion of your uterus is called the cervix. So once you enter the cervix, well, when you go to the gynecologist and get a speculum exam or a pap smear, this is what they're looking at. This is your cervix from this kind of cross-sectional view. So this portion, this kind of area right here is called your cervical os. Once you go through that, you enter the cavity of the uterus. If you were to be pregnant, this is where you would carry your baby. These are your fallopian tubes, and these are your ovaries. Let's take a closer look at the cervix. So this is what your cervix is supposed to look like. So notice that it's nice and pink. This is the cervical os. There is a little bit of fluid in there because this area is supposed to be nice and warm and like not nice and warm. It is warm, but nice and moist. Also notice that the kind of vaginal wall is kind of rugated or kind of rough. That's all normal. Now, when you have cervicitis, this is kind of what you're looking at. So cervicitis is basically inflammation, kind of swelling of the cervix. So notice how the cervix no longer has this pink color. It's this red, angry color. And also it has this kind of mucus looking discharge. So this is definitely an unhealthy cervix, and this is what cervicitis can look like on your speculum exam. It's important to note that about 85% of women who have this infection have zero symptoms. So that means that you can't look at somebody and say, oh, okay, you look like you got chlamydia. No, it doesn't work like that. Tell you, most people with chlamydia don't know they have it. If you were to have symptoms, you can experience vaginal discharge, pain with having sex, bleeding after sex. So if you're experiencing any of these symptoms, these are very good reasons to go get tested for chlamydia or just to see your primary care doctor. The next infection we should look into, or next site of infection, is urethritis. So the urethra is basically where urine comes out of the body. So for women, it's above the vagina. For men, it is through the penile shaft. No pictures this time. So for men, mainly men, I would say, about only 50% of them will actually have symptoms that they're infected, right? So if you are to have symptoms, you can have pain when you pee and kind of a mucoid discharge. However, again, you can't look at somebody and say, "Oh yeah, you look like you got that chlamydia." So it's really important that we're getting tested regularly, especially if we're having multiple sex partners or having sex with multiple people, unprotected sex with multiple people. All right, so some of your treatments, the most common thing you've probably seen is, oh, okay, just give a gram of azithromycin. So you take a couple. Usually it's like two. Sometimes if you have the 250 milligram formulation, they'll give you 4 pills to take all at once. Sometimes people get some kind of abdominal cramping. They may feel nauseous. It's just because you took that high dose. It will go away. Another thing you can also give is doxycycline. Take that twice a day for 7 days, or levofloxacin you take once a day for 7 days. But most providers prefer to give azithromycin because you can give it to a patient while they're in the office and be done with it. Sometimes people don't take all the medicine or share their antibiotics, so the doxy and the levofloxacin choice aren't going to be, your preferred therapy. All right, so this is basically an abdomen test, and this is how we diagnose. So you get 2 swabs and then this tube full of liquid. This swab is basically if you have to clean the area, you'll use it, but most of the time I just throw it away because it's just confusing for me, it's confusing for patients, and for the most part, it's not necessary. So it's this blue probe that you basically swab the area, whether it's the cervix or the the urethra, and you place the tube, like you take this top off, you place it in the liquid transport media. This kind of breaks off so you're able to close it all at once. Very quick, simple test. And this is a nucleic acid amplification test, or a NAT. So it's basically looking for DNA. Chlamydia is one of those bacteria that's very difficult to culture. So to use this kind of technology makes it simple and easy to diagnose. All right, so now we talked about primarily kind of genital regions of chlamydial infections. Now let's go a little bit further. So one disease that this can cause is LGV, or lymphogranuloma venereum. So in this case, someone may get kind of a genital ulcer, and the ulcer may like completely go away, and then afterwards they get this kind of painful bump in their, we call this the inguinal area. So just to kind of orient you, this is the person's abdomen, this is kind of their hip region, this is going down to the genital area, this, if we track down, this will be the penile shaft, this will be the scrotum, and in this area we have lymph nodes. Like normally it's supposed to look, the skin is supposed to be looking like this, but it's angry, it's red, this is very painful. Sometimes this area can have pus in it that requires drainage, so it can be really, really uncomfortable. So unlike the other infections, the cervicitis and urethritis, that can be asymptomatic, this one is very symptomatic, and it's actually caused by different strain of chlamydia. So there are multiple different types of serologic variants or different strains of chlamydia. So this LGB is a totally different class, and it specifically causes this to happen. Another kind of along the same vein, another region you can get infection is the rectum. So this is a picture of basically the colon. So when you get a colonoscopy, and they kind of sedate you and they stick the camera in, this is what the GI doctors are looking for. They want the inside of your rectum to be kind of smooth, shiny. You can clearly see the blood vessels. You don't see a lot of debris. This is very, very healthy looking. However, if you were to get chlamydial infection, look how angry it is. It's swollen, it's dull appearing, you have some areas of bleeding, so it looks totally abnormal. Again, this is something called proctitis or proctocolitis. I call it the rectal, but the technical term is proctitis. So this is going to be the very end of your kind of GI system, the rectal area. We call it kind of proctitis when you have infection there. And you will be symptomatic. You can have bleeding, rectal pain. You can have this mucoid discharge or abdominal pain. A lot of time, these infections can mimic or can look like a group of infection called inflammatory bowel disease or IBD. Specific examples of IBD include Crohn's disease or ulcerative colitis. So I have had patients who have gone to GI doctors with these symptoms, and they're like, well, you could have inflammatory bowel disease. And when they, ended up doing testing for chlamydia, they actually had chlamydia that needed to be treated. Alternatively, I've also seen people who their doctor only tested them for chlamydia of the urethra. You can either swab any mucus from the penis, or you can have your patient do a urine test. That's like one of my favorites. Do a urine test to look for infection in the urethra, because remember I said the urethra is what urine flows through. So you can use a urine sample in order to perform the test and look for infection. So if you only do that, remember I told you just give them a dose of azithromycin, or you treat them with doxycycline for 7 days. However, when we're thinking about treatment for these things, you need 21 days. So doxycycline for 21 days or erythromycin for 21 days. Most people go for the doxycycline because you only have to take that twice a day. Taking a medication for 4 times a day is extremely difficult, and so it's not the first choice most people go to. All right. So the last thing we want to talk about is a disease called trachoma. This is something that's not that common in the United States, but I thought we should talk about it because it's a common cause of blindness worldwide. So this right here is an eye. If you ever kind of like inverted your eyelid, the inside of that eyelid looks nice, pink, smooth, moist. However, this one looks unhealthy because it has these like white kind of, bumps on it, and the actual eyelid itself looks kind of thick. Then this is kind of the later stages of this disease. So first, when you get chlamydial infection in the eye, the actual eye itself can become red, the eyelid becomes swollen, but eventually this swelling, if it's left untreated, this swelling can get so bad to the point where eyelids, the upper and lower eyelids can turn, normally your upper eyelids kind of point outwards towards the world. But what advanced trachoma infection can do is it can invert your eyelids into the eye. And notice how this eye looks kind of cloudy. So if you look at someone, you see clear green or clear brown or clear hazel. But because this these the hairs or the eyelashes have been scratching the cornea, it's now become cloudy. So it makes it more difficult to tell the eye color of this patient. So this is very advanced disease. So as I said, this is the leading cause of blindness worldwide. And this is due to chlamydia infection. So basically it's caused when someone gets infected fluid like from the urethra, from the cervix, from somebody else's eye, from somewhere else, and get it into the eye. So we primarily see it in less industrialized countries because it's unfortunately seen where in areas where people have low access to clean water and sanitation. So treatment is pretty extensive for this disease. So first it involves 3 to 4 weeks of either erythromycin or tetracycline. So systemic basically means that these people are taking pills for 3 to 4 weeks. Then you're given 6 months of topical therapy. So most likely like topical like erythromycin for 6 months. So you're looking at around 7 months of therapy in order to eradicate this infection. So the World Health Organization is tackling this because, like I said, it's like a leading cause of blindness worldwide. So through this eradication strategy called SAFE. So first is surgical correction, right? So remember how you saw the picture where the patient's eyelids were turned in to the eyeball itself and was scratching the eyeball. So they do corrective surgery where they fix that. So that's one. Two, the second thing is they give antibiotics, as you just stated. Third thing is they encourage facial cleanliness. And again, this is kind of like in areas where it's just difficult to have access to clean water. So the last thing is they improve access, improve areas where water and sanitation are an issue to reduce transmission. So specifically, someone has like, for example, chlamydia in the genital region, or they have chlamydia, the trachoma or chlamydia in the eye, and you're having to reuse towels or reuse cloths, and you don't have access to clean water, or you have access to water but you don't have soap or anything like that, then you're going to have this type of infection.
Thank you for watching. If you enjoyed this video, please click like and subscribe to my channel. Until next time.